Good morning, everyone. We'll get started here in just a minute. I'm going to let some folks' calls get in. We're already at just over 60 folks. I'm already getting a chat. Oh, good morning, Michael. See, the chat function's working. So today we are going to be covering a few miscellaneous updates as well as bring you up to speed on our quality and safety survey and a few other little tidbits. We'll probably be together for about 40 to 50 minutes. As we have these virtual town halls, you already know that you can ask questions through the Q&A button on your Zoom, or you can enter a chat, and then the executive team and the leadership that's on this call is going to help me monitor both the Q&A and the chat so that we are sure to answer your questions while we are in the virtual town hall. But if you don't get a chance to answer a question, or you just want to really think about it before you ask, go ahead and just send us an email to virtualtownhallquestions@stvin.org. We monitor that, and then we are sure to include the responses when we post the final Zoom, this PowerPoint, and the Q&A on the Venturenet by Friday. Our next town hall will be 2 weeks from now. So recall that we're only able to now do 2 a month because we want to keep you engaged and interested in what we're talking about. So 2 a month on Tuesdays at 9 a.m. So let's see, let's go ahead and get started here. We are looking at just over 100 folks so far on our town hall. This is very cool. Okay, so we're going to have a poll after Kathy shares her inspiration with us today. Dr. Gonzalez is going to give us an update on our COVID-19 response. Dr. Marks is going to share with you the results from our Culture of Safety survey. Then there'll be a series of miscellaneous updates. There are leaders on the call that are going to give you some quick tidbits of things that are happening in the organization. Allison's going to lead us or close us out with an inspirational story, followed by our poll to close out our town hall. So with that, I'm going to turn it over to Kathy.
Good morning. I like the sparkly slide.
Happy one.
Good morning, everyone. I have an inspiration from George Bernard Shaw this morning. And it really captures for me the kind of energy that I have seen that we've all lived through together over the past few months. So it goes, my life belongs to the whole community, and as long as I can live, it is my privilege to do for it whatsoever I can. I want to be thoroughly used up when I die, for the harder I work, the more I live, I rejoice in life for its own sake. Life is no brief candle to me. It is a sort of splendid torch which I have got hold of for this moment, and I want to make it burn as bright as possible before handing it on to future generations. So thank you for being our bright light and for holding on to the torch, particularly over these past challenging months.
Thank you, Kathy. That was lovely. All right, so let's get started with our first poll. This is our way of getting feedback from you. I want to hear how you all are doing, but also lets us make sure that everyone knows how to use Zoom. So it's pretty easy stuff. I'm going to go ahead and launch our first little poll here, and our panelists can also respond. But the question for those of you that are calling in and can't see the screen, it says, what do you like about these virtual town halls? And you can pick as many as you want. It's not a single answer. It's a good way to get an update about all things CSV. The next best way to, quote, see each other. The COVID-19 updates are helpful. I can catch up on previous virtual town halls on the Venturenet. So if you miss it live, you can see it on Fridays. And we keep them posted. And then the final answer would be, don't know yet, this is my first. Okay, we'll give that about 10 more seconds. And I'm going to end the polling. sharing the results with everyone. The top answer was, it's a good way to get updates about all things CSV. I agree. It's one of my favorite things to do too. And then the COVID-19 updates are helpful, followed by the next best way to see each other. And there's probably one person in there. There's one person that hadn't come to a virtual town hall yet. So thank you for doing that little poll. We'll have one at the end. And we're going to go ahead and get going on our next series of slides. Dr. Gonzalez, would you lead us in walking through this slide?
Good morning, everyone. We continue to have a very robust testing program. And as of yesterday, 6,700 people have been tested. Over 6,200 were determined not to have COVID-19. You'll see that we have 330 persons are waiting results, and that's because there's a backlog at the national testing sites or state testing sites, as well as with other people that we use. Currently, as of this morning, we have 7 COVID patients being cared for in the Frost unit. 2 have been successfully discharged yesterday. We've had 11 COVID-19 related deaths, 73 total COVID-19 admissions to date, with 70 individuals representative, and we've had no workplace acquired COVID-19. And I just want to add that we've had an uptick in cases statewide and in Santa Fe County. We're seeing more admissions from northern New Mexico. They're younger people, they're less critically ill, and we're seeing less patients that are on mechanical ventilations, yet all patients are still quite sick.
Thank you for that. Okay, Dr. Marks, and will you let me know when you're ready to go to the next slide?
I will. Thank you, Lillian. So my name is James Marks. I'm the Executive Director of Quality, Patient Safety, and Organizational Reliability. The hospital does a culture of safety survey every 2 years to measure how we are doing, making sure that staff feel safe while they're at work, able to speak up when something isn't right, in order to keep our patients safe. So this is the results of the survey that we did. It started in February, so it was before COVID-19 hit, and we were able to complete it before we switched all of the modes that we're currently operating in. So the next slide. So these are the domains on the left side. We had a total of a little over 1,000 people who responded. 40% of the staff did respond that they had reported a potential safety error. So the numbers on the top represent the things that we scored very well in. Teamwork, expectations, frequency of events are the top 3. And then the bottom 3 are non-punitive response to error, handoffs and transitions and staffing. So I'll go through a little bit of the detail in there. Next slide. So first, what we scored best in was our strength, and that was teamwork between units. So the way this is scored, if you agree with this, that number is shown in the purple. So 87% of the people agreed with the statement, people support each other in the unit. Next, when a lot of work needs to be done quickly, we work together as a team to get it done. In this unit, people treat each other with respect, and when one area gets busy, we help out each other. There were 147 comments for this section, and the vast majority were complimentary of how well we're doing with teamwork. Next slide. So the second highest was a supervisor and manager expectations and actions promoted patient safety. Again, when people agree with it, it's the high score of 82, with my supervisor says a good word when he or she sees a job being done according to patient safety procedures, and that the manager and supervisor seriously consider staff suggestions when improving safety. The next 2 questions are called a reverse score. So what happens is you would answer this that you would disagree with this statement. So the statement in the bullet point number 3 is, my manager overlooks patient safety problems that would happen over and over again. So 75% of the people disagreed with that answer. And you'll see a couple other reverse score questions in the survey. And then the other was whenever pressure builds up, my supervisor wants us to work faster, even if it makes taking shortcuts. 77% of the people disagreed with that. There were 82 comments with that section. Next slide. And finally, to round out the top three was the frequency of error reporting. First, when mistakes are made, how often does it get reported? 79% of the people agreed that it's reported when there is a potential safety event. When it might have potential harm to the patient, 67% of the people agreed. And the same thing when it's caught and corrected, 67% of the people said that that gets reported. 31 comments for that section. And then the bottom three for opportunities. First was a non-punitive response for errors. So the staff feel like mistakes are held against them. This is a reverse score. So about 60% of the people disagreed with that statement. Next, when a report is when an offender's reported the person feels like they're being written up, not the problem. Again, only 50% of the people felt that it potentially was punitive when they would report a problem. And last, the staff worry about mistakes that would be kept, that they make that would be kept in their personnel file. Again, reverse score, 64% of the people disagreed with that, 67 comments in that section. Next is handoff and transitions. So shift changes are problematic, and 54% of the people disagree with that statement. So we know shift changes can be problematic because there's change in personnel and we are continuing to care for our patients. Important patient information is lost during shift changes. Again, 59% of the people disagree with that statement. Problems occur during the exchange of information across hospital units, so inter-unit transfers, and then things fall between the cracks when transferring from one unit to another. 64% of the people disagreed, and there were a lot more comments in this section, 101 comments. And then the last one, which had the most comments and had the lowest score, was staffing. So the first question was, we use temporary agency more than is best for patient care. 55% of the people disagreed with that statement, which means 45% of the people agreed. Staff in the unit, staff who work in the unit work longer hours than is best for patient care. That was about 50-50. We work in crisis mode, about 50-50, and then we have enough staff to handle the workload, 50-50. So what we will do is we will take this information and the comments, and we are working on patient safety messaging that we used to have a patient safety fair, which we obviously can't do. So we are going to be working on a traveling show that will be unit-based to cover some of these opportunities that have been identified, and to thank people for working together so well. I think that's the last slide.
So James, we do this survey annually. For how many years have we been doing the survey?
Actually, it's every 2 years. And I think this is the third time that we've done it. We used a different tool. We're using a different tool this time, the one that Christus Health is using for all of the hospitals and the Christus Health system. So there's a little better comparability. And compared to other Christus hospitals, we actually scored pretty high.
And would you say that each year we're actually scoring higher than the year 2 years prior?
We used a different tool last time, so it's difficult to compare the previous tool to the current tool. But overall, when I look at comparing it with the other Christus facilities, we're doing quite well.
I think when we look at the results on this particular survey around safety, and we look at side by side to the results on associate engagement, we see some really tight similarities. You know, the level to which we create engagement in the workforce in a high trust environment, and we really focus on zero harm and safety overall, we see that the scores are going up and improving both on the associate engagement survey as well as this patient safety survey. So I think it's we almost need them both together to get a good sense of how focused we are on prioritizing the safety of ourselves, of each other, as well as patients. Would you agree?
Yes, I definitely agree. And I know that sort of as a nice segue for Sandra to put a plug in for the next pulse survey.
Well, Sandra, there's your plug. You want to talk about that? Because I'm going to go to this next slide. Thank you, James. Oh, I won't go to that yet. Yeah, I will. Sandra, talk about the Glam Survey.
Perfect. Good morning, everybody. Thank you, James. It is perfect timing. We are going to do our next quarterly pulse survey. It begins on Monday, so Monday morning, bright and early, you will receive an email from Glint asking you to participate in the survey. The survey last time and this time is really focusing on gathering information about how you feel during these very unprecedented times that we've been experiencing over the last few months. So it's a little different than what you saw in the past, but what we were able to determine last time were the actions that we needed to take to make sure that you were feeling safe in the workplace. So I really encourage you to take that survey once you get your email on Monday morning, because it's very valuable information that we're able to take immediate action on, especially when you share comments and give us specific examples of what you need in order to be able to do the wonderful job that you do and to feel safe at all times. Thank you.
Thank you, Sandra. So Justin, you get the great happy slide here. Are you there?
He's still muted.
Oh.
Okay, I'm right here right now. Thank you.
Yep.
And looking at this is our patient experience performance. We've got to wrap up fiscal year 2020, and some really amazing news. A lot of us have been working on making our patients and family members' experience at Christus St. Vincent absolutely the best that we can, given the situation with COVID-19 and our ability to have fewer people in our facilities, find ways to improve our communication, shift over full force to iPad visits and inpatient services in ED with family, and telehealth visits and phone and video in our clinics. Really an amazing amount of change in a very short period of time. And in this environment, we were able to meet our patient experience goals and exceed them in our inpatient services, people discharged from the hospital, our emergency room visits, where we actually scored as the second highest scoring large ER in Christus Health. Our outpatient surgery, volume 2, another area has been very disrupted, and our outpatient services. So it's like sports medicine, the cancer center, radiology, lab, our outpatient services at the hospital. So amazing achievement given this environment that we've been in. We were able to maintain and even improve our experience for patients in all these cases. Our clinics were very close, but we know that this is an area where we really need to focus on. We got a large number of visits in our clinics, and they almost hit their goal. They were like this close to it. So we know that that's an area where we can really help with being able to establish consistency and a baseline of great communication in our outpatient clinic environments, and also working with our providers to help improve their communication with patients and build on the strengths that they already have. Then we'll be working on just kind of reinforcing some of the stuff that we have been doing well, but essentially our focus got taken off for a little bit while we were working on COVID-19. So we'll be working on that in the ER and our inpatient setting.
But all that being said, truly, these results are impressive, given that the last 3.5 to 4 months of our fiscal year were during this pandemic experience. And for us to hit these goals in this environment, it's incredible. It's really inspirational, because it says that the work that we do every day in caring for each other and our patients is really real. This is who we are truly. And the fact that the data is supporting that is quite impressive. So that's a huge thank you to our entire group of associates that are making this happen every day. Hey, Ruben. We're having technical difficulties. So Ruben's in my office. He's going to give us the volume update here in a minute. So we'll head over to our next slide. So Hope, you want to talk about this slide here on visitors and screening changes, or would you like to have Justin do it?
Sure, Justin can walk us through it. So we have been working to make some changes to allow more support people in. So Justin, if you want to talk about those specifics.
Yeah, absolutely. And our biggest change, which happened Monday before this past one, was around out of state or folks have had out of state travel. Either they are out of state here visiting Santa Fe, northern New Mexico, or Mexico residents that traveled out of state in the past 2 weeks. We really wanted to make sure that we were being safe, and we were watching out for information from the governor's office and the Department of Health on safety, as well as listening to our associates and folks here in the hospital that saw an increasing risk, and the fact that we've got states around us that had cases spiking. So we did implement not allowing family and support people into the hospital that had not met that self-quarantine period of 14 days. It was definitely, I think, our toughest week last week. It's gotten much easier because people are now okay, I'm getting close to my 2 weeks here, or I've now completed 2 weeks, and they're not surprised. It was tough. Our first couple of days were the people who had been able to come one day and then not be able to come the next. Those were our hardest ones. And we make these kind of shifts. They're definitely tougher. And then we learned a lot about getting the word out faster so that people knew what was happening, and folks are prepared when we make a big change like this. We are asking for valid IDs when folks come in, so we can tell, are they New Mexico residents? We still ask the question if they left the state in 2 weeks, but we also will be checking about if it's a non-Texas ID, then we ask some additional follow-up questions to see if they've been here for that 2 week window and completed their quarantine period. One situation where we are allowing folks who have had out-of-state travel into the hospital is that end-of-life situation where, as Dr. Gonzalez does a really good job of describing, is we have so much more to gain, and this is such a very difficult time for family and loved ones, for patients, that we will allow them 15 minutes to be able to come in to say goodbye. It's going to be very brief, very short. We're not going to be increasing our numbers of folks at the bedside or number of visitors in a 24-hour period for end of life. But to give them that opportunity, if their child or loved one comes in, say flies in from California, so they do get that chance to say goodbye. But it's going to be a brief visit to reduce the amount of risk. And then the most major change for, in addition to out of state for last week and this week, is now our surgery and digestive health patients, as of last week, are allowed to have one support person to come in with them for both emotional and physical support too, as well as being there for transport. And then as of tomorrow, our cath lab and interventional radiology patients will be able to have one support person to come in with them too. And we're going to be utilizing our ICU lobby for that. So these are some pretty big changes, and we're really doing that to help make sure our patients have the support they need while working very hard to maintain a safe environment. So we have to be strict on these things, but they have really helped us provide better services and improve our communication with families, especially for surgery.
Yeah, and particularly around surgery too. We had scenarios where our support people were needing to stay at the hospital and they were waiting in their cars. And with temperatures going up and things like that, we want to be supportive to those family member and support folks as well. And so that's another reason we felt it was important then. And we have seen a calming effect on the patients knowing that their support person is accompanying them into the building. And so we really feel like it's been good overall, but we are watching it very closely. Obviously want to keep safety as our first priority.
Yeah, and I'll reinforce what you both said. We want to ensure we have an environment where our patients can have their loved one with them. It helps calm them. But we want to keep them safe, our associates safe. And so the restrictions are really about our focus on safety and keeping and reducing the spread of the virus. You know, the virus doesn't discriminate, and anything that we can do to minimize exposure it's certainly not going to be, it'll be more helpful than not. But it does create some stresses just to be aware of. I'm sure that I certainly know for our screeners, they take a lot of heat from people that don't like our policy. And I know that our care teams also feel guilted by family members when they're not allowed to bring their entire pack into the organization. But I encourage you, when you're presented with those situations, that you remind our visitors, our caregivers, that our focus is on the safety of their loved one and of them, and that anything that we can do to ensure their safety is our priority. But it is challenging. I'm not going to make it sound like it's an easy thing. It certainly is challenging, but incredibly important. So when you see our screeners in particular, be sure to appreciate them because they are the front line for grumpiness. And my goodness, the things they've heard, the things that they've had to deal with I continue to be surprised. All right, so we'll go to our next slide here. We have a number of items on this slide because there were some questions that came up. Again, if you have questions, go to the Q&A or go to the chat function. And oh, hey, Sandra, there's a question here for you about the Glam survey. What's the time frame for this survey? It starts when, ends when? It's right here, August 9th. There we go. Look.
Right, it starts July 27th and ends August 9th.
All right, yeah, I forgot I put it on there. Wow, so efficient. I clearly need coffee. Okay, so these are some questions that came in. I'm gonna just work around our leadership team to get them answered. So James, would you answer our question about what kinds of COVID tests are available?
Sure, and we did get some questions submitted. So we are currently doing two different kinds of COVID test. One is a virus test, which is a nasal or an oral swab. And then we're also doing an antibody test, which is a blood specimen. And those are used for different scenarios. We are screening patients who have COVID symptoms with a virus nasal swab test. And then we are using the antibody test to do screening of asymptomatic people, particularly people coming in for surgery or a special procedure. We're using the antibody test. We are trying to be very good stewards of our resources. We actually have three different kinds of virus testing that we can do. It's also called PCR. One is a rapid test, which we can get in about an hour. The second is what we call the Panther test, which gets run once a day, and it gets run in the morning and resulted in the afternoon. So that's about a 24-hour turnaround. And then we have the availability to send out specimens for PCR virus testing to either Mayo or to Tricor. And that takes anywhere from 3 to 7 days. And we are seeing longer and longer time periods for that. So it's been somewhat of a challenge. We keep on needing to modify our strategy based on the availability of our test kits and the availability of the test result to be able to come back to us in a timely manner to make decisions.
So one of the big discussions at the state level with the other hospitals and with Department of Health is that there are a limited number of tests. We're all competing with hospitals around the country and in New Mexico and states' departments of health that are trying to get a sufficient number of tests to even test asymptomatic. So we're competing globally, frankly, for tests. We are having to be very thoughtful about what tests we use and when, so that we have the tests we most need should we have a spike at some point. The governor, through her various public health orders and press conferences, has communicated, as we've discussed before, to the entire population that they can be tested. So we have a number of curious but well people, asymptomatic people that are very interested in being tested. We do not have the resources to be doing that. So our peer-based review team, led by Dr. Gonzalez, has had to make some decisions about prioritizing the use of our tests. And so since the tests are not being provided by the state or additional resources to test curious but well, we are utilizing our tests for our symptomatic patients, our patients pre-surgery, associates, should they need to be tested for a circumstance that occurs. Generally, those are the buckets because we can't just test people that want to drive up and be tested. James or Dr. Gonzalez, do you have anything else you'd like to add to that, or Hope?
Well, we're still only doing testing at the CCAT clinic for patients who have a referral from a physician, so you can't just drive up. There's going to be some changes to the site of that collection coming up soon, probably before the next town hall meeting. So we might want to mention that.
Well, Hope might have some update here. Hope, you want to give people a head start?
Yeah, so our CCAT clinic is currently at the Milagros School. And so knowing that schools we'll be reconvening at some point. We need to be moved from that by early August. And so with that then, we've chosen a new location. Our new location is going to be 1910 Cerrillos Road. And it's actually a quick loop where you could drive through and get your oil changed, a building that's vacant. And so we are currently looking at getting a lease for that building. We will be changing the name also. It won't be called CCAT going forward. It's going to be called Respiratory Collection. And so that will be our new location. And so we're working diligently to get that in place very, very quickly.
It'll give us the easy in out driving. It'll be a much improved process.
Mm-hmm.
So, you know, in addition to tests being really a precious resource and our conservation and utilization of them is really very important, PPE is equally important for all those very same reasons. So I'm going to ask Monica to give us an update on PPE and ask Dr. Gonzalez or James to jump in should you have more to add there. So Monica.
Great. Good morning, everyone. PPE has been top of mind for the entire executive team since the beginning of the pandemic. We want to make sure that we're conserving appropriately, managing responsibly, following CDC guidelines, and to ensure we have plenty of supply for you when we experience a surge. Here's what we have on hand. With our current daily use, we have 41 days worth of gloves on hand. We get that supply weekly, so we have adequate supply. We have greater than 3 months of supply with the blue disposable isolation gowns, the yellow isolation masks, and the N95s. This is because we're using the cloth isolation gowns that are washed between use and are reprocessing the N95s in our sterile processing department. We have adequate supply in the warehouse of the PDI Super Sani disinfectant wipes, so the purple tops, the bleach wipes, those are the orange tops, and the Flex wipes and Clorox wipes. So we're trying to source that on a daily basis. The materials management team is doing a fantastic job in getting that so that we can replenish supply. So if you find yourself without appropriate PPE or disinfectant, please let your manager know or the house supervisor so we can quickly get you the supply that you need to protect yourself, your coworkers, and our patients. Thank you for continuing to manage the PPE responsibly.
Thank you, Monica. Hope, you want to talk about facility improvements, and then we'll go to volumes and revenues. There's a question that came in, James, on the travel requirements. And so after Ruben, I'll go and pull up that slide so we can refresh people on the travel and quarantine requirements for associates. But Hope, facility improvements?
Yeah, facility improvements and different changes that are going on. So I think everyone knows that we are planning to open PMC on August 3rd. So we're getting ready for that. And then other facility improvements that are occurring, 2200 is slated to reopen early September. So 9/1 is our date right now. We are looking then at taking 3300 offline, and we'll be doing some remodeling construction up there, and probably we'll begin that around September. The area on the second floor that used to be lab, as you know, lab moved to Frost, and so that area is currently under construction, and pharmacy and heart diagnostics will be moving into that space, and we anticipate that opening around January 1st. And then the heart clinic will be moving over to Plaza on the first floor, and we anticipate that opening January 1st. Our acupuncture building, which we're currently working on a new name for it, but we will be moving a couple of clinics over there, and that will also be January 1st. Foundation is actually moving to the second floor where central registration used to be, and they should be moving around August 1st. And then the surgical clinic in Plaza, it was on the second floor. It moved to the other side of the hall and opened in their new space actually today. It's very beautiful, so if you haven't been over, drop by and see it. It turned out really beautifully, and again, today's their first day. And then ENT, which is currently on Hospital Drive, will then be relocating to the surgical clinic previous space that they just moved out of. And that's slated for about 4 to 6 weeks from now. And then also just to mention the front lobby, if you've noticed, we repainted it. And so now it blends in much better with frost. So when you're coming off that frost hallway, and in the future, we are planning to replace the flooring in that front lobby, but we're still working on the phasing as to how we'll do that because we know that there will be some disruption with that. So we're still in the early stages of planning and the timeline for that. Okay.
Perfect. Thank you. Michael Potok, you asked, is there a slide for this info? Which info? The facility improvements? And while you're typing a response, Ruben, you want to go ahead and share your volume and revenue slides?
Okay. I guess I have to share my screen.
Yep.
So if you can stop sharing.
Okay, there we go.
Look at us all. Okay.
Oh, like Hollywood Squares.
Yeah. Now I have, okay. So just very quickly, I've been showing now for quite a while how we're doing week over week in some of our major volume initiatives or just volumes that we measure. And as has been the case for a while, it's been a slow, steady upward trend. The upward trend has had a few little, you know, ups and downs within it, but definitely we're still heading in the right direction in all areas. If you look at surgeries, for example, you see that we had a big drop. That was during the week that included the whole July 4th weekend. So that's no surprise. And then there's always a nice little spike coming out of a holiday weekend. And so we had a fantastic week coming out of that. And then this last week, 154 surgeries, kind of dropping back to normal trend there. And you see that kind of across the board. The clinic visits dropped and had a big spike and now have come back to a little bit more normal on trend. But overall, you can see that in most areas, we are steadily climbing up. We've seen a little bit of softening in the ED visits. You know, if this were a normal summer, this wouldn't be surprising. Summer is often not boom time for our emergency rooms. So I think there's a strong likelihood the ED volumes will remain soft for a while until we start getting back in the fall. Normally we talk about back to school and things picking up again. And obviously all of those dynamics are going to be a little bit off this year. So it'll be interesting to keep tracking this, but overall we are doing a nice job recovering. I saw on the introductory slide, Lillian, you asked about how did we do this last fiscal year. For those of you who don't know, we're on our financials are not on a calendar year, they're on a fiscal year that starts July 1st. So we just ended the fiscal year 2020 on June 30th. Spent about 2 weeks working on closing the books and everything, and I'm happy to report that we just hit our budget for FY 2020, and that's not counting the federal assistance that we got. We did it on our own, guys, because to be quite honest with you, we did everything we possibly could to adjust our expenses to match the volumes that COVID was giving us, and we really did a fantastic job. April was pretty grim, but in May and June, we did an amazing job clawing back both business and keeping expenses under tight control, and that enabled us to cross the finish line just ahead of budget. And that is important, not just because it sounds good, it's important because the money that we make is the money that we reinvest into St. Vincent's via our capital expenditure. You know, we spent about $25 million in capital investments last year. And in order to keep that kind of rate going, to keep our facilities refreshed, to take advantage of new technologies and so forth, we have to continue to have a strong bottom line because that's what funds that capital. And so it's great for St. Vincent's that we finished ahead of budget.
Thank you. I love these slides because it shows the progress that we're making and creating confidence about for patients to come here and get their care.
Yep.
So, love it.
Okay, I'm gonna stop sharing, give it back to you, Lillian.
Okay, thank you. All right, so one of the questions that I'm gonna answer, there's 3 questions in here in the queue. One of them is around what are the requirements for associates that travel and their need to quarantine. James, do you want to handle that, or do you? I will say that we sent, Dr. Gonzalez sent an email specific to those requirements about a week and a half ago. We also have, we put it on a things to know, and I believe it's on the Venturenet. But I think with folks wanting to do some summer travel, you don't want the information until you most need it. So someone might be getting ready to go on travel and needs to know what to do. So James, do you want to speak
Sure. So we covered this in the last town hall, and there was a slide. So if you go back to the last town hall, there was a slide that discussed it. But people asked me questions about the quarantining. And the governor's executive order from July the 1st exempts healthcare workers and people who do business with essential businesses who come in from out of state. So out of state travelers who come in to work at our hospital are exempt from the 14-day quarantine. We are still recommending that if you do travel out of the state, please make sure that you are practicing COVID safe practices, wearing masks in public areas, social distancing, and be aware of the group that you're with to see if anybody potentially develops COVID. But there's no requirement for 14-day quarantine for healthcare workers or people who are coming to work here on business-related business.
But I remind you all to exercise good judgment, whether you're on travel or going grocery shopping. Wear your mask, ensure safe distance between you and others. Do not congregate with people, especially those you don't know, in settings that you're least familiar. The virus, again, it doesn't discriminate. We're seeing many more in a younger demographic getting the virus, and you bring it with you. So just be incredibly mindful of all of those key behaviors to focus on safety. There are two other questions here. Dr. Gonzalez, how accurate are the PCR swabs?
Mm-hmm. Yeah, and then I want to couple it with the antibody tests as well. You may have seen antibody tests being used. I want to stress that we're using antibody tests purely for screening, not to make a diagnosis. So we're using them mainly, especially for our pre-surgical cases in asymptomatic patients who have passed the screening test. The issue with the antibody test is it has a higher than we would like false positive rate. Therefore, anytime we get a positive, we back it up with a PCR test. The beauty of the PCR test, it's very specific because it measures, it detects, it's an amplified test, and it detects the viral RNA of the virus. As far as its sensitivity, it has a very high sensitivity, greater than 96%. Therefore, anytime we have a positive antibody test, we back it up with a PCR test, and we're confident that the patient is COVID-free.
And James, what about, we've been asked over the last few months, at what point are we going to be ready, or other health systems, to test their employees, their workforce? What are the limiting factors? What does that look like?
So are you referring to our workforce or outside?
Ours.
So for our workforce, we are offering testing. If you feel like you are having symptoms, you need to see a provider and evaluation, and then you can get tested. As an associate, if you want to be tested, we are permitting that through the 913 docs number currently. That may be changing sometime in the future depending on test supplies. But if you get tested as an associate, your test result or your test will be sent out, and you would get the result back in, again, 3 to 7 days from now. So we're trying to ask people who are concerned about exposures that they talk to employee health if you're concerned about an exposure. But we do currently have that available for associates. And that information has gone out to several of the managers. If you don't have that information on how to get tested, contact your manager, and I'll make sure that they get the instruction sheet.
Great, thank you. There's a question here, I don't quite understand it, but it says, what would be the guidelines for relocating to another state, as there would be several trips from one to another? I think it's very similar to what you've already shared, James. Someone's going in and out of the state, but you want to reiterate?
Right. So the quarantine period, again, does not apply to healthcare workers and people who are here on business for essential businesses, which the hospital and all the clinics are included in that group. So yes, going back and forth would potentially put you at risk, but you've got to be careful of what you're doing while you're going back and forth, where you're staying, if you're staying at a hotel, and restaurants, potential exposure in a restaurant.
Great, thank you. Any other questions on the chat? I don't see anything. I don't see anything on Q&A. I'm going to go ahead and head to our next slide here. Allison, you want to talk to us about some inspirational stories?
Yes, thank you so much. So I'm Allison McIntosh. I'm our Chief Information Officer, and I get the pleasure of sharing our inspirational stories from a few of our patients. And this really just shows us how we are really living our mission in the clinics during this time. So we had a patient that visited our CSV Family Medicine recently, and they said that they felt safe during this COVID time because of the precautions that we took, that they never felt uncomfortable. And part of this was because so few in-person visits were happening, and that social distancing was an easy way to have, that we're doing a good job with our social distancing. So that was really nice to hear. We also had a patient visit our ENT clinic, and they said that the surgeon and his staff were exceptionally kind, caring, compassionate, and skillful. Everyone listened, paid attention, and made them feel that they were really cared about and cared about their welfare. And then we had another patient that visited the...
We lost Allison there. We lost the IT person.
Hold on. Am I back? Sorry. Can you hear me now?
Yes, we can.
Okay, great. We went over my history and why I was there, and I felt included in the decisions regarding the next steps in my care. My questions were answered, and I never felt like Dr. Shaw was in a rush. I left confident that I am in a good place to receive the care I need. So really nice to hear some of these experiences that our patients are having during this time, that they are still having positive experiences visiting our providers and our surgeons in our clinics.
Great, thank you. That last one was Urology Associate. All right, again, if you have questions after our town hall concludes, please send them to virtualtownhallquestions@stvin.org. And we're going to do our closing poll. And let me get that. It's the one we do each time because I like the feedback to know how we're doing with these town halls. So for today, what did you think about this town hall? Was it were the topics helpful? Was it too long, too short, took the right amount of time, convenient, etc.? And again, while you're filling out the poll, these slides, all of the questions and answers, as well as the Zoom that will be recorded, they will all be found on the Vintranet by Friday. And if you go look there now, you'll see the ones from the last couple of months. They're sorted by theme, so you can just pick the one that you feel like you missed but you're most interested in, and you can stay caught up with where we're headed. Our next town hall will be in 2 weeks on a Tuesday at 9 a.m. Marketing will send out a reminder in the morning, and that way you can jump on board and join us again. And hope you all stay healthy. Take care of you. I'm going to end the polling. And helpful topics took the right amount of time and convenient. So thank you for saying that about our virtual town hall. Be well. Take care of you. Know that you can reach out to any of us on the executive team or your leadership team if you have questions about things that we covered or failed to cover. If you have ideas for future town halls or things you're interested, also use that same email. Would love to hear from you. And that's it. Stay well. Talk to you soon. Bye.